Well, when I indicated to Nancy Pelosi, that, look, I cannot support, I can't support giving any more money, to this war. I voted not to do this in the beginning, and now to come and to ask for additional money. And she looked at me, and then she walked away, and then she came back, and she said, Ed, we have to give money to bring the troops home. And I said, well, if we bring them home now, there's enough money. And she said, Ed, we have to bring all the troops home. We need money to do that. And she looked at me, she says, we can't bring them home on freaking flyer miles. And that stayed with me. And of course, as a result, I voted, for the resolution with time certain and all of that. But here again, many people like you, felt that no money was actually needed to bring the troops home.
Yeah. If you look at what the president has done, he always holds money in other accounts. He has the money to bring the troops home. Here's how much it would cost to bring the troops home: $5 to $10 billion. Okay. Now that's troops and equipment. I mean, you got to figure you have 150,000 troops. I mean, if you were to talk about each one of them paying $1,000 for a ticket from Baghdad back to the States, or let's say $2,000. You're not talking about an extraordinary amount of money here to bring the troops back. The truth is that the Bush administration has no intention of bringing these troops back, and Congress knows that. Our leaders know that, and that's why they have to stand up to him and say, "We're not going to give you another dime. Done. It's over. Bring them home. We're not going to offer another appropriations bill." Now, there's a lot of people in good conscience who said, "Okay, we're going to go along with the leadership because they seem to have a plan to take us out of there," but they haven't. They intend to stay. That's why I take exception with my own Democratic leadership. I've been involved in politics for 40 years. I've been involved in politics longer than most of the people in the Congress. And I can tell you that I can't be shake, rattled, or rolled on this issue of Iraq. We've got to get out of there, and we have to stop funding the war. You want to get out of Iraq, the easiest way is to stop the funding. That's the way we've always got out of any of these wars.
What about those people saying, hey, let's cut a deal? I mean, let's just go in and work out some arrangements. I mean, what do you say to that?
Check it out now. Cut a deal. If you stop funding the war, then you can fund domestic priorities. But if you keep funding the war, then you got to talk about cutting a deal to keep domestic spending going. We're borrowing money from China to fight this war against Iraq. We're borrowing money from China. We're digging a hole. When I was growing up, there was a story about if you dug a hole deep enough, you could get to China. We're there. Okay? We're there. And what I'm saying is that we've got to stop digging a hole, and we've got to end the war and stop using that money for the war. Now, those who are saying, let's cut a deal, let's fund the war and then fund domestic priorities at the same time, blood money. Blood money, pure and simple. I don't buy it. It's wrong. It's morally wrong. We've got to get out of Iraq. You can't link the two. It's wrong to link the two. And we've got to start thinking about those troops. Bring them home. And I'm ready. I'm ready the minute that this leadership says, Mr. President, not another dime, I'm ready to support their efforts then.
Right. I know you've been here now 11 years. You've probably had some disappointments, and you've probably had some happy moments. What are some of the happy moments that you've had since you've been here? I know voting in terms of the war. I'm very familiar with that one. So,
well, when I first came in, the day I was sworn in, Ron Dellums came over and stood next to me. Ron Dellums, who I had admired from a distance, came up and stood next to me. He says, "I want to stand next to you and watch you sworn in." And that gave me a good feeling because here's somebody I looked up to. And when Henry Waxman came over.
He's now the mayor of Oakland, California.
He is the mayor, right. And when Henry Waxman asked me immediately to be on the Government Reform and Oversight Committee, that gave me a good feeling. I appreciated that. The opportunity to be able to participate in so many of the debates about international policies. It gives you a good feeling to be able to stand in there and speak out. To work with John Conyers on a bill that's going to change health care in America. H.R. 676. It's the Conyers bill that I'm the co-author of. I know you're a co-sponsor of that, and we're very grateful to have you're working with us on it. That is such a good feeling to know that here is a vehicle where everyone can have health care. No more premiums, co-pays, deductibles. People don't have to worry about going broke anymore because there's someone in the family who's sick. And so I feel really excited about being able to work on that. I mean, there's so many areas where you can do good for people. And back home in the district, being able to help people with casework, that is the best feeling in the world. When you know you can help one person, and as I know you do the same thing, it's like when you help one person at a time get things done, that's what my office does in the district. And so, you know, it's an honor to serve in the Congress of the United States. And I want to add that what you've shown on some of the big questions on the war, on health care, and on impeachment, you've shown a willingness to take a stand as well, which is why I'm glad to be on your show, because I'm on this show because of the stands that you've taken, because I appreciate the stands that you've taken. I just want you to know, I wanted to mention that. And, you know, I have found that there's a lot of good people in the Congress of the United States. It's what makes the job worthwhile, working with good people. So I appreciate being here with you.
Well, thank you very much. I really appreciate your kind words, because I must admit that I admire many of the positions that you take. And when it comes to health care, in terms of your views on health care, when it comes to your views on education. Now, I know you chair a subcommittee. You know, what jurisdiction does your subcommittee have?
I'm the chairman of the Domestic Policy Subcommittee of Government Oversight. We have jurisdiction over all domestic policy in the United States, with the exception of Homeland Security and the Department of Defense and Information Technology. But what I have done is taken that subcommittee, and here's what we've done. We've looked at subprime loans and how people are getting ripped off in the inner city, particularly people of color, who are lured into these loan packages where they get a chance to own a home, but there's all these hidden charges and all these unmentionables that come back later to haunt people, and they get foreclosed on. We have an epidemic of foreclosures all over America right now. It's primarily hitting people of color. I'm the first person in the House who led an investigation of this. First person in the House who led an investigation into what Wall Street was doing. They're building up all these hedge funds, okay, with these subprime portfolios. Individual investors have very little understanding of what's happening. They go to initial public offerings, so there's no or little or no protection for individual investors. I'm the one person who forced a look at some of these big hedge funds, so much so that when one of them was going to an initial public offering, when they found out I was investigating, they accelerated their initial public offering because they didn't want the questions being asked before they took it to market. Furthermore, I'm the only one that asked the questions about Medicare and Medicaid and the games that were being played in the inner city. Let me tell you, Elijah Cummings and I had a hearing where we looked at the fact that some of these companies that were private services contracting with Medicaid for dental services in inner city Baltimore, they took a capitated payment. They were getting paid to serve people, but they weren't serving people. In one case, a 12-year-old boy by the name of DeMonte Diamond was supposed to get dental care. You know the case.
Yes.
He was supposed to get dental care, had an abscessed tooth. He couldn't get care. His mommy couldn't find a dentist, okay, because all the ones on the list, they weren't there. 12-year-old DeMonte Diamond, beautiful child, dies of an abscess that went to his, a tooth abscess that went to his brain. And you know, so we started an investigation of that, looking at all these companies that are making money, not providing health care, which a lot of these insurance companies do. So this domestic policy subcommittee goes deep into things that affect people's lives and look at and affect people's economic livelihood and their health. And so I'm really honored to have that committee. We've had 17 hearings.
Wow, 17 hearings.
17 hearings since I've taken that subcommittee in February.